Good morning, this is Heiko from the Acupuncture and Air Show. Today we're going to be talking with Sarah Molony from Wakatani. Now, she specialises with acupuncture, of course, and in the treatment of women's disorders. Good morning, Sarah, how are you?
Good morning, Heiko. Very well, thank you.
How's it over at Wakatani? Are you looking at the beach there, or what are you doing?
No, I'm currently staring up into the beautiful sky amongst the trees, and it is a clear, crisp and sunny morning, but boy, is it chilly.
Okay, yeah.
Thank you for having me on the show.
Now, listen, first what I like to, when we have a new speaker on the show, because I'm always interested, and I'm sure that many other people are interested, how did you first become interested in acupuncture, and did you study here or overseas, and where are you practicing now?
Well, many years ago I worked in television, so it was quite a big change to swap over to acupuncture. I was with a group of friends and we decided when I was living in Auckland to go kayaking down the Kuhua River. And it was a glorious day, but much to the surprise of everyone, including our guide, we came around to the final point in the river, which was the widest point we could see our destination. And a freak storm had come from the sea and swept up the river, and we were caught in the middle of it. And the winds were so strong that I could barely lift my paddle, I remember we're kayaking, above my elbows. So we really battled and battled to get to shore. And when I got to shore, I crawled out of my kayak, couldn't stand up straight, and turned out when I went to see an osteopath that I'd managed to partially rotate vertebra all the way up my spine and was in absolute agony. And I've always traditionally gone to osteopaths, and I think they're amazing. But my practitioner said to me after a series of sessions, Sarah, I actually don't know what else to do with you, because I put you back in place and then you call me 20 minutes later and everything's popped out and I've tried everything. I really don't know what to do. Please go and find someone else. And like most of the patients who now come and see me, they've tried everything else before they come for acupuncture.
Yeah.
So I discovered a gentleman who was working in Auckland called Neil Banning. I don't believe he's practicing anymore, but he was a wonderful man, and he picked up on what was going on with my back. But what amazed me was that he picked up on all of these other little things that I found all the way through my health. But every time I'd gone to the doctor and said, oh, I'm always cold and I'm really tired, and all of these various things that didn't seem connected from a Western medical perspective, I was always told, oh, you're just a little stressed. And I'd been told this by multiple doctors and was beginning to think maybe I was going a bit moggy. So when I went and saw Neil, it was amazing because he picked up on all of these little imbalances, and he made me realise that actually everything was connected. I wasn't going mad, and there was something we could do about it.
Fantastic.
And so he fixed my pain brilliantly, and isn't it amazing? Everything wouldn't pop back out of place again because he toned all of the muscles. But everything else started to balance and improve as well. So for the first time in years, I basically felt like myself again.
And then you saw the light, did you?
I saw the light. And I couldn't believe that you could create such an amazing change or series of changes with a few needles and some herbs. It blew my mind. So that's what got me inspired to do acupuncture. And I actually then met a lady who is actually an acupuncturist in Pakistan named Emmeline Taylor. And she's been a very successful lawyer and had changed to Chinese medicine when it has affected her amazingly. So when I met her, I remember thinking, golly, if she can do it, I can do it. So I went and retrained.
Fantastic.
So I studied at the New Zealand School of Acupuncture and Traditional Chinese Medicine in Auckland. And I graduated with a Bachelor of Health Science degree in acupuncture and a diploma in Qigong. And I was very lucky because I managed to get a postgraduate job. I was working at the Body Workshop in West Auckland. And that was an amazing opportunity because it was like a big umbrella organisation working largely alongside physios, but we worked alongside specialists, massage therapists, they did yoga, mindfulness, all sorts. And it was a really good way of seeing how acupuncture works on its own, but also how it works with Western modalities. And there were a group of acupuncturists working together, which is quite rare these days, I find. So that was an amazing opportunity. And I just loved it. And I helped to run a women's health clinic when I was there as well. So that spurred the women's health side of things. And
that's how you got interested in treating women's problems and whatever.
Yeah. Well, that was an interesting thing for me because for years and years, as I said, things have been out of balance. I managed to get glandular fever when I was at university when I did my first degree, and following that, I had chronic fatigue.
Yes, you had a good collection of stuff, Sarah.
A good collection, yeah. I'm one of those interesting patients who come through the door.
Yeah.
So when I had those issues, that played with my menstrual cycle and worsened the period pain that I'd actually had since I was a teenager. So when I started getting massive amounts of pain, I saw the doctor. They suspected I had endometriosis, and I was frankly quite terrified of having a liposcopy because some of the research I'd looked into said that some people it actually got worse, and I thought, I'm always the odd one out. I'll be guaranteed to be that one person that has a problem. So I went down the traditional Chinese medical route and was treated with acupuncture and herbs, and that just worked absolute wonders. And it made sense that that was the thing that I would follow in because I had a little bit of an understanding and appreciation as to what women can go through. So
and now you've got quite an interest with fertility as well, isn't it?
Yes, very much so. Yeah. So I have an acupuncture clinic now that I've started in Fertility. I began last year. It's called Inner Glow Acupuncture. And I do all sorts of things. We have a lot of people who come in for back pain, etc. But my major interest is fertility and women's health. And do
the women ever ask you, like, is there research being done for fertility? And
we're often asked that. It's and yes, the question is a definitive yes. In fact, there is an increasingly large amount of research being done, which is wonderful. I'm very grateful to our TCM colleagues who spend hours poring over their research and putting together research papers so that it backs up what we do. And we all know, and we've known for thousands of years as practitioners, that acupuncture has a huge effect on fertility. But there are some really interesting studies out there, and particularly around fertility in relation to IVF, which is wonderful because not very many people know about this. So a lot of studies have started to show that if you have acupuncture and traditional Chinese medicine and you do use that alongside IVF, it increases the chances of live birth rates, not just pregnancy rates, which is what IVF will tell you, but live birth rates by at least 35%, which is really huge when you think about it. IVF normally is talking about just getting pregnant, and those rates are pretty small. So it really does help to boost those chances. And I was lucky enough when I was working in Auckland to be involved in one of those studies looking at the effectiveness of acupuncture with fertility. So we had sham acupuncture versus normal acupuncture, and it was really quite fascinating. So yes, there very much is.
And do you find that the women coming to you now, because everyone's researching and reading and getting their opinions from their specialists and doctors, and then they think, okay, we'll try traditional acupuncture or Chinese medicine, and then they want you to sort of to change this hormone or change this enzyme level or do something to change this ovary over here. And then from our point of view, or from my point of view, we're treating liver blood deficiency or stuck energy in the liver or something. So how do you deal with that when you talk to those patients?
Well, I try to use it as a stepping stone. So most women who've been trying to conceive who've had difficulty have been going through quite a lot, and often they've done a lot of research on their own, or they are going through the Western medical side of things, they are going through IVF, or they're considering it, and they've done a lot of research. So often they will come in and they will have all of the jargon down pat. So you get this huge amount of Western medical information, some of which is actually quite useful. But I find it works as a stepping stone because you can see what's going on with them. It gives them a nice, clear idea as to what's going on so that they can visualize and understand what's happening or not happening in their system. And then I use those explanations and use traditional Chinese medicine and weave the two together. So you can say, well, this is happening from a Western medical perspective, but our understanding of this particular scenario in traditional Chinese medicine is blah, blah, blah. But you can see how these are connected. So I start with their knowledge, and then we grow their knowledge. And often they sit there and go, oh, that makes sense. Okay. And then you've got them, and they're fine. A lot of them as well come in, and they are so desperate to fall pregnant that they will try anything. And those words come time and time again. I've tried anything and everything. I'll do whatever it is. You want to stick me with 100 needles? Do it. I just want a baby. So that's also helpful from our perspective too, because they're on board. But it's learning to speak their language and then explaining it into ours so that the two match up. And it's quite useful too. So for things like BBT charts, which are more of a Western medical thing, it helps to give us an idea from a TCM perspective as to different imbalances that are going on. So you can actually use some of the Western medical tools for our own benefit in TCM.
How do you find, working with the doctors and the specialists, like in a particular, like in a smaller town like where you are they sort of receptive to it, or are they a bit sort of, that's that witch down the road there? Yeah, so do you have much feedback from them?
I haven't had very much feedback. Most of my patients come to me off their own accord, and it's usually through word of mouth. So their friend has said, acupuncture is really good, or maybe they read an article when they were doing their research into what on earth could possibly help. So generally speaking, my patients in my little Whakatane area, they tend to come to me and do their own thing. When I was working in Auckland, particularly I think because I was involved in that study, I did work in and amongst Western medical practitioners. And they were perfectly happy for us to be doing our thing as long as we didn't interfere with what they were doing. But I think the way it came across was that the patients felt secure and happy to have us there as their presence, their support people, and therefore that was okay for us to do our thing. So if I was working on somebody who was undergoing IVF and they had the transfer, you go and treat them before and after. And usually there was no problem. They'd provide a room for me. I could go and I could treat them before, I could treat them after. Everyone was very smiling, but they didn't stop and want to know what I was doing or why, but because they were busy. But that worked perfectly fine. As far as I'm concerned, as long as we can help with the patient.
Now, are you finding that, with the IVF, is that... most of your fertility patients are having IVF, or 50% of them, or?
Yeah, when I was in Auckland in a much bigger setting and we had a lot more people to draw on for our clinic, I would say probably about 80% of them were IVF-based.
Right, okay, yeah.
And 20% not. And now, just in my experience down here, 100% of them are not doing IVF, but some of them are thinking about it.
Right.
But the great thing is they've come in, I've explained that it takes a bit of time to get everything balanced, and I would recommend starting, if you're looking at going down the fertility route and you're thinking about IVF, if you can have a good 3 months before you go into IVF to help with getting everything balanced through traditional Chinese medicine, that the chances of attaining a good pregnancy and birth
a live
are
birth,
much greater.
Yeah.
And they tend to listen to that. And in my experience, they haven't needed to go down the IVF route because the TCM has worked.
Yep. Now, just checking here on the time, Ken, how are we for time? We're still okay? Good, yeah, because just before we go, I'd just like to talk a little bit about the Qigong, because I know that you've done a degree with the Qigong when you did your Chinese medicine training.
Yes, the diploma, yes.
And so if you could just very briefly just tell us, how do you try and incorporate the Qigong into your clinic? And very, very briefly, if we can, tell us what Qigong is.
So Qigong, very roughly translated, is the mastery of the movement of Qi.
Right.
It's a branch of traditional Chinese medicine, like acupuncture and herbs, and it's divided generally into two kinds. It comes from different forms. You've got martial forms. I was trained in a medical form. The first type of that is what we call internal Qigong, which is when you do exercises that largely resemble Tai Chi, and you master the movement of Qi in your own body through particular movements and breathing exercises. And that can have effects on things like, I need to tonify my spleen Qi, so I do this movement and it works on my spleen. Or, my liver Qi stagnates, if I do these moves, it will help to move the liver Qi. So that's the one part. The second part is what we call external Qigong, which is what practitioners use to help work on their patients. So it sounds weird and wonderful, but those energetic channels that we tap into with our acupuncture needles, you can actually learn how to feel above the person. You can touch them too, but you can learn to wave your hands over the person, and you can pick up on blockages and imbalances in the body, and therefore encourage the person's energetics to balance. which is fantastic. So I find it a really useful tool for when my patients come in just to see what's going on. It gives me another diagnostic tool. And when I perform Qigong on my patients, it generally makes them feel really calm and relaxed. And commonly when you're dealing with people who have infertility, they're quite stressed and quite anxious. So it's a marvellous tool for just helping to get them to relax.
If there's one thing I've found, Sarah, that women trying to get pregnant are the most stressed and anxious and worried people of all patients.
They are indeed. And some people might think, oh my goodness, and run the opposite way. But for me, it's such a magical thing when we make it work and their bodies respond and they feel good. And for me, that's the magic of the medicine. But finally, with the Qigong, what I like to do as well sometimes is I will give them Qigong exercises. So I will use that internal Qigong. At the end of the treatment, I say, okay, well, your liver tube's stagnated, so I would like you to do these particular exercises, and I'll give them a prescription, show them how to do it. And it gives them something that they can do, because so often with infertility, they feel like everyone else is doing their stuff, but there's nothing they can do. It's out of their hands. And that lack of control is a huge thing that women deal with. So the Qigong is just something that they can do to help make themselves feel better. And I find that really helpful.
All right, well, listen, we better finish up here. And so thanks for coming on the show, Sarah. And
thanks for having me.
I'll put your clinic details and everything onto the comment section into the YouTube. And, of course, people can always ring the radio station if they miss the chance where you are. And just to finish the show, we're going to play one of Ken's, because he's an absolute Beatles devotee, and we're going to play a song from them called Dear Prudence.
Who wouldn't know that song?
That's right.
A song all about Mia Farrow's sister.
That I didn't know.
Did you know that, Sarah?
No, I didn't. You learn something new every day.
Yeah. All right, thanks again, Sarah. We'll see you in the next show.
Wonderful. Thanks very much.
Okay, bye.
Bye.